We need to now walk our talk.
We must now walk our talk. Those words summed up the 2023 message of the Director General of the National Health Insurance Authority, NHIA, Professor Mohammed Nasiru Sambu, to management and staff of the agency.
I said it times and times again, that in terms of policies that will require to develop health insurance in Nigeria, I don't think if there is anything that is left, I stand to be challenged. We have the 10-year strategic plan. We have the mechanism for coordination health insurance under our rule. We have the state health insurance agencies. We have done a lot of work in digitalization. We have done a framework for strengthening our state offices. We have a policy, the drug policy, that will address a thorny problem of access to drug in health insurance, and so on and so forth. So all the policies that will require to drive health insurance in Nigeria are now in place. The next thing is, how do we get them implemented? And the point of implementation is state offices. The point of implementation is across the states. So how do we ensure that we have very credible people that can drive these things? Otherwise, we will sit here, develop all the policies, do all the training that you want to do, but you cannot move an inch because of the incapacity of the people that we have at the state level. So therefore, ladies and gentlemen, we need to work very assiduously to put mechanisms in place for effective implementation of this NHIA law.
Professor Sambo delivered his message at the first Top Management Committee TMC meeting to mark the commencement activities for the year and provide direction.
He stated that all policies required for smooth and effective implementation of health insurance in Nigeria was now in place, noting that staff are expected to put in more hours at work to actualize the authority's mandate.
We have worked assiduously to deconstruct these pillars of our reform that even culminated into the development of a 10-year strategic plan. And therein we put in so many initiatives like developing a framework for increasing access to health insurance by establishing or by developing the informal sector program, the gift ship, which was launched by the Honorable Minister. We have also worked assiduously to ensure that we transit from manual operation to digital operation by developing an overarching ICT infrastructure. We work assiduously in terms of recreating the image of the organization through strategic and purposeful engagement of stakeholders. We met quite a lot of stakeholders. We have developed within this framework health insurance under our roof, which serve as a platform for coordination of activities between the National Health Insurance Authority at the center, as well as the state health insurance agencies. And the most important success that we have recorded has to do with amendment of NHIS law, which we now have National Health Insurance Authority Act. There are two very distinct features of this new law. One, it makes national health insurance in Nigeria mandatory. Number two, it has created a vulnerable group funds, which will be an ingredient that will push attainment of universal health coverage.
The Director General stressed that 2023 would be a year of a lot of work, with the overriding task being the implementation of the NHIA Act.
We will continue to work in this year 2003 to see how summit can be done, how we will ensure effective operationalization of the National Health Insurance Authority Act. This is the major task that is before us. We have yearned for the amendment of the Act. We have gotten the Act, and now the ball is in our court. We have to ensure that we develop a very credible framework for the implementation of this Act. This will have to. This will form the fulcrum of what we are going to be doing in the year 2023.
To underscore the importance of the implementation of the NHIA Act, the Director General announced the setting up of 3 crucial committees.
We have talked about 3 basic committees that are very critical for the implementation of this Act. Number 1, we say we need to have a committee of mandatory social health insurance. Number 2, we need to have a committee that will look at innovative financing. And number 3, we have to ensure that the committee that will develop or revise a guideline are established.
Within the context of state offices as operations hub of the authority's efforts, Professor Sambo noted that more work needed to be done, hinting that restructuring of state offices were inevitable to position and reinvigorate them for effective performance.
We look at the fact that Abuja is a microcosm of Nigeria, but if we are to make any headway in attainment of universal health coverage, we must have a very credible state offices who will serve as a full soldiers for expanding access. And we have developed a framework where we reorganize and rejig the state offices. The state offices. We also try to introduce or to employ healthcare professionals to further fortify the state offices.
He noted that state offices are to drive the marketing campaign for the flagship service platform, the Group Individual and Family Social Health Insurance Program, GIFSHIP. However, their performance in the outgone year left much to be desired. He added that the chief reason for the imperatives of the restructuring was actually that same performance of the previous year.
We also have a lot of initiatives that we need to see that they are fast-tracked. GIFSHIP has been developed, but if we look at the rate of penetration of GIFSHIP, I think it leaves much to be desired. I have it on record that there are some states that currently they don't have even one enrollment of GIFSHIP. And this state have coordinators. We pay them, we give them a very big office. We give them all the working tools necessary for them to penetrate to ensure that GIFSHIP is deepened, but yet these are not happening. So in this year, we are going to create a framework that occupation of any office, either in the headquarters or at the state level, it has to be based on competence. Seniority will not only be the guiding principle of occupation of office in this organization.
The DG said no sentiments will be entertained in the efforts to reposition state offices.
Where it is possible, where there is no clear person that we are confident he will drive the state office, we will subject the people that are due to occupy that position to scrutiny. That is to say, henceforth, in 2023, we will ensure that the most competent person in any state office is the one that will be the zonal the state coordinator. And this is not new in the national health insurance.
In consideration of the financial standing of the authority, the DG said the agency in the year 2023 would only embark on activities that have direct bearing on expansion of coverage.
The DG was delighted at the emergence of NHIA as the best among the MDAs assessed by Servicom for customer responsiveness. He described the honor as encouraging.
Be more active, more proactive in what we are doing. Next time we are not going to look for Servicom award, but we'll look for presidential award for the best. Okay? It is also available that you are the overall best nodal officer in the whole of the entire country. So the organization is also rejoicing and congratulating you for that. So well done.
Thank you, sir.
More grease to your elbow.
Reflecting on the milestones attained under his watch, Professor Sambo noted that all activities under his leadership have drawn inspiration from the 3-point rebranding agenda.
Taken together, the DG's iconic words to every staff continue to resonate. We will continue to work until NHIA becomes the pride of all Nigerians.
We have been working to see that everything is fine, every Nigerian benefits. As I always say, we shall continue to work until NHIA becomes the pride of the nation.